Hello, I'm Dr. Ryan Budwany, and today we're going to talk about the posterior lateral arthrodesis procedure using the Minuteman technology from Spinal Simplicity. The first portion of this talk today is going through the single-use kit that we're working with. The advantage of this kit is that it's available every time you need it, every single time that the patient's ready for it. We start off with the guide pin. The guide pin is really important here because it allows us to actually go to the direction that we're looking for and to keep that track going through the entire procedure. The value of this guide pin is essential because, as you will see when we demonstrate it under flora on the cadaver, is that it helps to not only facilitate the procedure itself, but it's a huge safety margin to make sure that you're exactly where you need to be for this implant. So you start off with dilator 1. Okay, dilator 1 is important because it's the first essential step in getting to where you need to go. After dilator 1, you'll insert dilator 2 and then dilator 3. Once dilator 3 has been inserted, you actually want to add on an extension. And the extension is going to be important because once you put that on, you will actually jump onto sleeve 1. Okay, once sleeve 1 is placed, then at that point, since you have the extension on, that's going to help facilitate the removal of every single dilator, but making sure that the pin stays in place. That's a key step that you want to remember. Once that pin is staying in place, you come back and you actually use this graduated tap. This graduated tap is actually designed with a lot of safety in mind, but also, if you can notice, and I'm not sure if you can see it on camera, but we'll see it on fluoro later on, is that you see these little insertion marks here. These marks actually correspond to the different sizes, the 5 different sizes that are available to help our patients, okay? So those are the different sizes of the implant that we're going to be using. With the graduated tap, this is actually built in to help open up the space that we're looking to put the implant into and to separate the area. Once we've identified the correct implant that we're using, then at that point, we actually use the inserter. So the implant is added onto the inserter, and then at that point, we can actually make the final versions of the impact. All right, now I'm going to talk about the G5 implant and the sizes available and the benefit. So if you look right here, how the wings are sticking out here, that's actually really important because of the large window that's available. That's where the DBM goes. And typically, each implant holds about 1 cc of DBM. Now, the unique thing about this G5 implant is that these wings, you can extend this while they're in the patient, but you can also retract them if you need to reposition them. That's a huge safety margin that's built in. Now, if you look right here, right in front of me, there are 5 different sizes available. You start off from 8 millimeters and go up all the way to 16 millimeters. The colors also correspond to a unique safety feature that's built in. From 8 to 12, you actually go with the purple color right here. And that purple color is actually it's the smaller sleeve that we use. Once you want to go from the 14 to the 16, you end up with the green sleeves. And that's just to help actually you kind of keep those different sleeves apart, but it also shows that once you're going into that larger size, you have different tools slightly that are available. So since we've covered all the instrumentation, we're going to be transferring over to the cadaver here so we can demonstrate this procedure for you. All right, so this is the cadaver demonstration portion of this lab. And the main thing is that really initially starting off with identifying the appropriate landmarks. So the initial picture is going to be the AP picture. That's important because in our lab today, our goal is to put the implant in between L4 and L5. And so we start off with a radiopaque instrument that can help us identify that picture. And so as you can see on that instrumentation, I can also use the guide pin if you need something a little bit more radiopaque to kind of demonstrate that picture. And so that's kind of where we want for our insertion point for that spinal needle. The spinal needle is really important because, like we spoke about earlier, that spinal needle helps us to identify the area, and it's going to serve as a landmark until we can get the guide pin in place. Once we get to this point and we've identified the area, okay, we want to make sure that we've anesthetized the skin pretty well, okay? And most of these patients, they're either going to be in MAC anesthesia or in general anesthesia. Regardless, we want to make sure that at any point we've identified the landmarks, we've anesthetized the skin prior to penetrating it, and then we've identified the exact area that we need to be at. Once we've identified that with the spinal needle, we're going to go back and actually move to the lateral view. Now, one thing that I want to comment on is I also anesthetize the tract as well. So not only do I anesthetize the skin there, even though we're not making any kind of generalized cut up here, but we're trying to anesthetize the tract because it keeps the patient more comfortable. All right, perfect. So as you can see in the lateral view, the spinal needle is exactly where it needs to be, okay? You want to be in the about anterior 2/3 of that the view right there. And then at this point, you can actually use the guide pin to demonstrate where the next landmarks are. And these are critical because of patient safety. Picture? Picture. Perfect. So in this view, we're trying to demonstrate where the landmarks are. And you want to make sure that the anterior portion of your marking is at the facet line. Picture? Okay. Picture? Perfect. Picture? And then the second line you're going to make is the posterior line here. Picture? So the reason I'm making the posterior line on this cadaver is because typically when you're actually beginning the insertion portion, you want to make sure that your implant actually ends up between the anterior and the posterior line. Picture? So that would be X marks the spot. That's literally where your implant should end up. Now, before we demonstrate anything more, I just want to make a key comment here, that the facet line is where you want to make that most anterior line. That's a huge safety margin of this procedure. Everything posterior to that is a safe zone of where we can provide this procedure. Now, once we've identified that line, we know where we are, we can go back to the AP view. So in the AP view, this is very important. And what I would recommend is, what I do in my patients is that I actually draw a line from where that spinal needle is all the way down to where the anterior and the posterior lines that I've drawn on the lateral view. Picture? And so the reason I draw that is because the way I think of this is as a runway. This is the way that we actually want to guide the guide wire as we're going from the lateral view. This is the pathway that the instruments are going to follow. All right, so as we've done that, now the next step in here is actually to make that incision. So we've made the incision, and the very first step at this point, right, is starting the guide pin down that incision. So as you can see on the x-ray there, you see that little dark point, that's actually our guide pin. And it's headed down that landing strip that we had created initially. And so the reason we're actually starting in the lateral position, this is very, very important. It's a huge safety margin for this procedure, okay? You want to make sure that you're staying posterior to that anterior line you've drawn, because that's the safe zone again for this procedure. So what I would recommend is that you continue this in the lateral view right here initially. Picture? Perfect. Picture? Okay. Now we know that we're in our safe zone. We go back to the AP view. So we've gone back to the AP view, and this is where we're going to be doing the remaining portion of the procedure. But again, I always recommend checking that lateral view because it allows us and gives us another security of that we are in the safe zone for that procedure. So at this point, we're going to begin by using dilator 1. Now, another tip here is that try to have your scrub tech, actually dip this in saline because it makes it a little bit easier to slide over the guide pin. Now we're in the AP view and I've inserted dilator 1. And as you can see, you can actually make out that dilator as we're going forward. And then you see that facet line there. That's kind of where you want to actually have this set. Picture? And so you can make it out where it's at. That one, our guide pin is stabilized. And two, the first dilator can be made out right next to where that facet line is. And that's where I would keep that first dilator. And then I would bring in the second dilator here. And just like in this pattern, we will continue forward. As you can see here, we have both our guide pin, our first dilator, and our second dilator exactly positioned where they need to be. So I'm going to use a third dilator at this point. And in some situations, you have to keep a little bit of pressure on here just to make sure that they don't get dislodged from where they've been before. So as you can see, all three of the dilators are there. We've already put on the extension. At this point, we're actually going to put on sleeve 1. So as you can see in this picture right here, okay, our guide pin is exactly where it needs to be. All the dilators can also be seen and they're where they need to be. And we've actually finalized our position with sleeve 1. So what I would recommend at this point is that put a lot of forward pressure on this sleeve 1 here, okay? And this forward pressure allows us to ensure that we remain in the position we need to be in as we're slowly taking out each and every dilator that we had put in. And remember, again, that typically I'll have like my scrub tech or somebody back here holding a little bit of pressure here so that we don't actually lose the positioning of the guide pin. So now we're going to use the graduated tap. And again, remember that this tap is going to help clear up that space and help to determine the size of the implant we'll be using. All right, now slowly just turning this clockwise as we're inching forward. So typically at this point, when you've kind of crossed over that line and you see the spinous processes, you can actually take out the guide pin because you no longer need it since you're already going down that trajectory. So as you can see, at this point, I've continued to apply that forward pressure to the sleeve just to keep it in place. And we've continued to accelerate forward with our graduated tap. Now, a comment I really want to make here is that if you can see, it looks like, from those halos, we are at a 12. But if there's a little bit of wiggle room and we move forward, you would be between a 12 and a 14. All right, so I'm slowly taking this tap out by removing it and rotating it in a counterclockwise way. So continuing to apply forward pressure to the sleeve here, we're going to use the inserter and rotate it in a clockwise way as we advance the implant forward. Picture. Okay, you can go live, please. Okay, right, stop there. Okay, again, as we advance forward, I just want to make sure that continuing to apply this pressure, it's really key here, because as we are going forward here, it's going to become very tight and you don't want to lose the channel that you have created. So to deploy the wings, all you do is you just come here and you apply a little bit of forward pressure on this back knob. Picture. 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 Perfect. Picture. There we go. Now, one thing to remember, right, before we move lateral, just to confirm our wing placement, is that by stabilizing the instrumentation here, it allows us to actually make sure that the wings have remained deployed the way we want them to. And we're actually applying a little bit of backwards pressure on the instrumentation. Now, typically in this, if you can get a little bit of wig-wag, you can see the wing line. And you can see that you're keeping the channels on here, the wing reference line level. You can barely make it out at the tip. You can make out the left lower tip of the wing there, but if we can apply a little bit of wig-wag on the x-ray, we may be able to get a little bit better view. All right, so as you can see, like we talked about, if you can apply a little bit of wig-wag on the x-ray, you can see the location of that bottom wing, and that's really important. So just for demonstration purposes, because we've not tightened down anything yet, if we needed to, we can still rotate. Picture? And so I like the location of the wings right there. So at this point, I'm confident that the wing placement is exactly parallel that it needs to be to the spinous processes, and we're going to go back to the AP view. All right, now that our wings are fully deployed, we're going to put the right hand on the main channel here, and then the left hand is going to go on the white knob here. This is knob 2. We want to rotate this in a clockwise way because it's going to help move that hex nut forward. Picture? Perfect. Picture? All right, so now that our implant is fully deployed, we're going to come back to knob 1 here, rotating in a counterclockwise pattern to remove the instrumentation. So about 3 to 4 turns back here will allow us to remove the instrumentation. Picture? Perfect. And in one single stroke, we're going to take everything out. Picture? Excellent. All right, and then go back to the lateral view just for confirmation. So we've returned back to the lateral view for one final picture, and it shows complete and proper placement of the G5 implant. So we've just completed the posterior lateral arthrodesis procedure from Spinal Simplicity. This procedure is extremely impressive. For my patients, when I tell them that we're going to try to solve the problems that we've discussed and we've worked up for them using a lateral approach, their eyes light up. They're like, how are you going to put this in my spine laterally? And as we've demonstrated today, that not only is this possible, but this allows us to preserve a lot of the natural anatomy for this patient, like the multifidus and the interspinous ligament. And not only that, the recovery as a result of this approach is a lot less in duration. So thank you for joining me today.